While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast, cardiovascular health. We all know it's super, super important. And we know about exercise, and most of us know about sleep hygiene and circadian rhythm. But what is the role of the oral cavity and the oral microbiome in cardiovascular health? I'm bringing in an expert and friend of mine, Dr. Ellie Campbell. She's an osteopathic physician, and she just published a book on hypertension, blood pressure blueprint. Get it while it's hot off the press. Welcome to the show, Dr. Campbell.
Thank you, Dr. Jackson. It's my honor and pleasure to be here with you today. I hope we can enlighten your audience on what I believe is the number one hidden risk factor to the number one killer in our country.
Yeah, so we'll piggyback off of my episode with Dr. Tony Ingram. So we talked about the oral microbiome, and she was familiar with the Balboni Method. Tell us a little bit about that method and what sparked your interest in it.
Yeah, so it actually started with a sort of, there's always a circuitous route, right? We never get there directly, but way back in early 2000s, I was becoming increasingly disenchanted with my conventional medical practice. I followed the best evidence-based guidelines in the country, and I was the diabetes collaborative champion with the Department of Health and Human Services. And for 13 years, I got really good at writing prescriptions, and I didn't see many people get better. I didn't reverse any cases of diabetes. I didn't reverse any cases of cardiovascular disease. And I was following the best evidence-based guidelines. So I decided to start my own solo practice so I could focus on a functional medicine root cause approach. And I did that for a few years, and I got sort of known as the regional expert for bioidentical hormone replacement therapy. And so a woman came to see me who was unable to have her second child. She was 42 years old and was told that she was now infertile and couldn't have kids, and she didn't believe that. So I helped her get pregnant. It wasn't that hard. She just needed a little adrenal support, nutritional support, vitamin D supplementation. She ovulated and got pregnant pretty easily. And then she sent her mother to me. So her mother wanted bioidentical hormones to help keep up with her much younger boyfriend. And D also had hypertension, which we treated, and high cholesterol, which we treated. So one day, D did not show up for work, and the daughter ran over to her house and found her mother collapsed on the floor, barely breathing. She'd suffered a massive stroke. She was paralyzed on one side. And I just felt terrible. Like, I'm her primary care doctor. She's depending on me to not let her have complications of these chronic illnesses, and yet here she suffered this condition. And so that she went into stroke rehab, and she was joking with me that it was going to take a lot of rehab to help her get her leg up to shape, because she was a line dancer, and you can't really line dance with one dragging leg. And then she suffered this horrible complication that happens in about 40% of strokes, and that's where the weak spot where the stroke was burst, and she developed a brain hemorrhage, and she died. And I felt gut punched because my experts failed me. My system failed me. So back in 2005, when I was getting ready to start going to conferences about how to start my own solo practice, I'd met a man named Tom Blue. And Tom is now with the Institute of Functional Medicine. And he offhandedly mentioned that he went to this great course on cardiovascular prevention. It was called the Balboni Method. And he said it was one of the best classes he'd ever been to. And it was so functional medicine based. It was all about root cause resolution. And so after Dee died, I said, I need to go to this Balboni course that had been niggling in the back of my head for 8 years. I was like, I need to go to this course and see if I can figure out what happened to Dee. And so I attended this course and I was mind blown, because this course talks about identifying all of the root causes of oxidative stress and inflammation, the obvious ones, hypertension and high cholesterol. We knew about those, but it's not just really high cholesterol, it's actually corrupted cholesterol, because high cholesterol is not a problem. People with the highest cholesterol live to be the longest. Yes, I just said that. People with the highest cholesterol live to be the longest, as long as their cholesterol is not corrupted. But if it's oxidized or rusted, if it's sugar coated, if it's the wrong shape or size, or if it's genetically inherited lipoprotein, little a, then that's a corrupted type of cholesterol, and that causes real trouble in the arteries. So I learned a whole bunch of root causes, including the one that I later learned was Dee's trigger. And now that I recognize this and I use this Balboni method and all of these root causes, and I've really expanded my knowledge in oral and systemic health, we've had 0 heart attacks or strokes in any patient for 7 years. So I think we've cracked the code. Brad Bale and Amy Doneen cracked the code 25 years ago. They haven't had any events in any of their patients as long as they follow the protocols, take their supplements, take their very targeted medication. And if you do so, then heart attacks are optional, strokes are stoppable, and dialysis is not your destiny.
Awesome. Very well said. So the Balboni method, it's not just focusing on the oral microbiome. There are other variables.
It's one piece of the whole spectrum of oral, of oxidative stress and inflammation triggers. And oral health is a major one that's often ignored in most programs. I don't think any program that pretends to prevent heart attacks and strokes will be successful if they don't include an oral connection. It's just too important. It drives so much inflammation. And I can tell with blood markers if a patient, with blood tests, if a patient has a dental problem most of the time.
Yeah. I remember you several years ago mentioned a case study of someone who had elevated cholesterol that wasn't responding to the traditional functional medicine therapeutic interventions. And you sent them to a biological dentist. They got their gums and teeth fixed. I think they even had a cavitation. CRP went down, cholesterol went down. And so that kind of stuck with me in my mind. Is there a test? So like, I know when I look at the gut microbiome, you don't want to just go in and, completely kill off everything, right? That's going to decrease the alpha diversity. So with the oral cavity, is it enough to take oral probiotics or probiotics intended for the oral cavity? Do we need to do some oral ozone? How does that work?
Yeah, I mean, I think it's a complicated picture, right? We now know that the mouth should have a vast number of microorganisms. Well over 400 organisms live in the mouth. These are spirochetes, viruses, bacteria, fungus. They are many, and they're supposed to be there. They're friendly players. Most of what is going to make us sick comes in through our mouth. So we need to have this vast diversity of a defense, a line of defense. But like everything else, we have organisms and we have terrain. And often it's the terrain that's the problem. And we can focus all day and all night on organisms, mouthwashes to destroy bacteria, ozone to kill bacteria, antibiotics to kill bacteria, surgery to cut off the infected gums, right? But if we don't focus on the terrain, we're never going to get that patient to a state of oral wellness. So yes, all those things are important and necessary in some cases, But I don't think that gum surgery or amputation of the infected part is really a good strategy until we've identified the pathogens, treated the pathogens, supported the immune system, supported the patient's nutritional status, identified any food sensitivities. Food sensitivities commonly cause oral lesions. Even in celiac disease, we know that recurrent aphthous ulcers, little canker sores inside your mouth, is often one of the presenting symptoms of celiac disease, a type of gluten sensitivity that can shorten your life if you don't learn how to live a gluten-free lifestyle. But there are other lesser sensitivities that may not be associated with the shortened lifespan that still can make you pretty miserable, right? They can give you everything from skin rashes and migraines to oral lesions to gut dysbiosis. So
Yeah, I know with
not an
my
easy
patients,
answer.
right? I know with my patients and clients, I talk about you can have translocation from bacteria in the oral cavity to the gut, or you can have translocation from the gut to the oral cavity. I reached out to a professor at Temple School of Dentistry like 8 or 9 years ago. I was seeing a lot of people on the GI map test with several pathogens that were related to what I found in PubMed to be related to oral cavity issues. He said,
Right.
I never thought about it that way, but you're absolutely correct. So is
Right.
there a
Well, you
test that
swallow a liter or more of saliva every day. Obviously, you're going to swallow a bunch of bacteria as well. But we know that if you just go in and try to annihilate them all, you're not gonna do well. Mouthwash like chlorhexidine will raise your blood pressure as much as 8/6 millimeters of mercury. So daily mouthwash is a terrible habit, unless that mouthwash is very specifically garnered to enhance the growth of the friendly bacteria, right? And there's only a few on the market that do that. Stella Life being one of them. It's essential oils and homeopathic based. So,
and what was the name of that one?
Stella Life.
Okay. Yeah, I think Dr.
Um,
Ingram mentioned that one.
But and the same is true for probiotics. I mean, we have a few probiotics on the market that are specifically targeted for oral bacteria, but you kind of have to remember that different pathogens do different things, right? We have one set of pathogens that's associated with caries disease or cavities. We have a different set of bacteria that's associated with bad breath. We have a different set of bacteria that cause gum disease or periodontal disease. And then we have a whole different set of organisms that are responsible for endodontic disease. That's at the root of the tooth. And those are mostly, but not always, mostly seen in root canal patients. Once you've had a root canal and you've removed the nerve and the blood vessel that goes to that tooth, a tooth is dead. And it's a dead tissue inside your living oral cavity. Well, we can never completely sterilize it. 100% of root canal teeth have bacteria living in the bottom. If your immune system is strong, you can keep that colonization of bacteria down to a low rumble. It doesn't cause necessarily an infection, and it may not even be associated with any degradation in your chronic health. But tip the scale just a little bit, your immune system can no longer keep those bacteria in check. Now they start to become pathogens. Now they start to grow an abscess. But that tooth doesn't have a nerve in it. You can't feel that abscess growing. You're getting a larger and larger swarm of polymicrobial infection, usually bacteria, yeast, fungus, spirochetes, all growing together in this massive inflammatory colony with inflammatory cytokines and lipopolysaccharides and all this nastiness. Every time you chew, those bacteria leach into your bloodstream. They can often set up shop in your neck and cause a plaque there. They can get in your bloodstream and set up shop in your brain. One of those periodontal bacteria called Porphyromonas gingivalis, we call him PG for short, he's a really nasty pathogen. He travels on white blood cells and moves throughout your body. So wherever your blood cells can go, which is everywhere in your body, Porphyromonas gingivalis can go. When it gets there, it begins to secrete something called phosphorylated dihydroceramide. This is a waxy plaque. This nasty bug not only makes plaque on your teeth, it makes plaque in your brain, and that can be detected on a scan as Alzheimer's lesions. So we don't want Porphyromonas gingivalis in our mouth. We want to get it gone, and that means working with a holistic or biological dentist to identify these pathogens in your spit and then work on a protocol to eradicate these bacteria, or you become at risk for plaque in your neck, plaque in your heart, plaque in your brain, plaque in your kidneys, and complications. So
I know there was a study, I mean, there's probably several, but one that came out last year, I think, that found a strong correlation between the bacteria in someone's mouth and the bacteria in their plaque, their brains, in Alzheimer's patients who had passed away.
yes, we didn't used to think that these pathogens left the mouth. We thought that they weren't, somehow or another, they didn't move. But the mounting evidence, now that we have PCR technology and advanced genetic testing, we can search for the genetics of these organisms, and we find these bacteria in the heart arteries that caused a heart attack. They're in the plaque, in the artery. We find these bacteria in the brain. We find these bacteria in the kidney. We find these bacteria inside the pancreatic cancer of a person who's dying from cancer. So these organisms, what happens in the mouth doesn't stay in the mouth, and it moves everywhere. And so no primary prevention program can really be complete unless there's a good dentist and a hygienist working with us to help us make this mouth as healthy as possible. But that doesn't mean sterile. The mouth should not be sterile. We need those bacteria, and they crowd out the bad guys. So we need to have healthy mouth bacteria.
Yeah, so if you do enough of the good guys through niche exclusion, they can possibly get rid of the bad guys, correct?
Not only possibly, they will. That's their job. And so what are some of the things, the habits that people have that make this environment uninhabitable to the healthy, friendly bacterial strains? Well, one of the most common, I think, is acid. We think about having a very acid mouth environment. Acid is for batteries. People should be slightly neutral or slightly alkaline. And if your mouth is acidic, it enhances the growth of the pathogens. Well, what would make your mouth acidic? Number one thing is mouth breathing. People who snore at night or mouth breathe. Next time you're in the airport, look around at all those people looking at their cell phones and see how many of them have their jaws dropped open and their mouths are open. They've developed nasal disuse atrophy. They're not breathing through their noses. They're breathing through their mouths, and that's making their mouth a very acidic environment and more prone to have these pathogenic bacteria. So that's natural acid. That's our body making acid. But guess what? You can sip on acid all day long. Many beverages that we've come to think of as healthy are very acidic. Coffee, for example, is very acidic. I don't have a problem with you drinking coffee. I do have a problem if you have a coffee habit and you have to have coffee all day long to keep going. If you want to have a cup or two of coffee in the morning and you enjoy your coffee ritual, I don't have a problem with that. Drink it all in one sitting. Do not sip on it all day long, because it takes about 20 to 30 minutes from the time that acid insult stops until the enzymes and bacteria in the mouth make enough buffering agents to pull that pH back up to where it needs to be. So it dropped with the acid food. When you get pH back up, it takes 20 or 30 minutes to do that. So if you're sipping on acid and you set it down, and 15 minutes later you're sipping on acid and you set it down, and you have a beautiful Yeti cup that keeps your coffee hot all day, you're promoting an acid environment just by the beverage that you drink. Apple juice is one of the most acidic foods on the planet. So for little babies with dental cavities, we would never think that that bottle full of apple juice that they're sipping on all day long could be a contributor to the environment that's enhancing the growth of those caries bacteria. So, and even many bottled waters, if you go online, check the pH of the bottled water that you're sipping on all day long, thinking it's a healthy habit, when in reality, the pH is quite acidic.
Should the pH, I know when we first wake up, if we test our urine pH, it should be acidic from detoxifying during the night. What sort of variation is there in the oral pH?
Yeah, it shifts as well, and it should be a little more acidic first thing in the morning, but by the time you get up and you had something to eat and you brushed your teeth, you should be back in that neutral category again, 7.4, something like that. So,
So
go
you
ahead.
mentioned terrain, and I wanted to expand upon that because that made me think of my good friend, Secretary IgA.
Yeah,
And if that's low, you're not going to accomplish very much. And what causes Secretary IgA to decrease? Stress,
stress,
cortisol elevation, low DHEA. Do
inadequate
you see that?
sleep, oral, yes, we see that. And we know that you have to have, secretory IgA is, we all know about immunoglobulins, right? We know through COVID, we tested IgM and IgG, and those came into people's lexicon and vocabulary. Most people kind of have an understanding about IgM and IgG, but there's 5 of those antibodies, and one of them is IgA, and it mostly lives on mucous membranes in the sinuses, mucous membranes in the mouth, the intestinal tract, the vagina. So we have to have this high secretory a normal secretory IgA. Too high is not good, too low is not good. They stand at the ready like soldiers to attack any foreign invader. And so we have to be sure that we have a good, comfortable crop of these secretory IgAs. Another thing about terrain that I think is important is something called nitric oxide. Nitric oxide is the miracle mouth molecule that's so important, it won the Nobel Prize. And it has many, many rules. If you think about all of the things that it does blood pressure regulation, blood sugar regulation, immune modulation. It helps open and dilate blood vessels. That's one of the things that was best known for. It's a gaseous signaling molecule, the first gas to be identified to have this role. And so it won the Nobel Prize. But if you think about that dilating blood vessels, you can guess what prescription drug was developed as a result of this. They were trying to come up with a drug that targeted the nitric oxide pathway, thinking that they could make a great blood pressure drug. And so they came out with this medicine, which was brand named Viagra, and they realized it was not a very good blood pressure drug. But man after man after man was coming to the clinic going, I like the side effects of this blood pressure medicine. This is really amazing. This has dilated my blood vessels in a way that they have not been dilated before. And so we came up with Viagra. But it turns out nitric oxide is made lots of places in your body, but the primary place is in the floor of the sinuses. And so you have to be a nasal breather to get good oxygen flow, and you have to have a healthy crop of secretory IgA and a healthy crop of nasal bacteria in order to be able to make nitric oxide. But the rate limiting step in the production of that gaseous signaling molecule is an enzyme whose name is nitric oxide synthase. And NOS, one of the primary places it's made is by bacteria that grow in the crypts of your tongue. So if you don't have a healthy mouth bacteria, you can't make the enzyme that makes nitric oxide that gets you that dilation of all the blood vessels, including the ones below your belt. So having a healthy mouth is really critically important to your sex life, your blood vessels, your brain, your kidneys. These organs all depend on good, happy, healthy nitric oxide. That's part of the terrain of the mouth.
Yeah, and one thing you said, I know Dr. Nathan Bryan in his book on nitric oxide talks about it's an entire signaling system. It's not just vasodilation. I mean, you got INOS, ENOS, NNOS.
Yeah, it's
Can
so
you touch
important. It gave
on
us a backup channel. Like it's so important that we have multiple ways to make this enzyme. But again,
Absolutely.
it was Dr. Bryan who taught me that the rate limiting step of NO synthase comes from bacteria on the crypts of the tongue, which is why it's so, so important. And why many of his products in his company's line from N101 are lozenges that you suck on, because that's where that enzyme is made. And that's what we want to support to get the most nitric oxide synthase when we give it the precursors to make nitric oxide.
Absolutely. So one thing you mentioned was maxillary width and sleep disordered breathing. So I have an oral appliance. I had an oral surgery way back in the day. My maxilla is now wide enough, but I just need to bring my mandible down and forward. And so I'm actually getting a new device on Thursday. I sleep with Max nasal dilators for nasal patency. I've done the nasal mutes as well. And I've had night lays to the posterior tongue.
Yep.
Can you talk about, for listeners who may not be familiar with, what's the connection between sleep disordered breathing and cardiovascular risk? Can you kind of elucidate that?
Absolutely. So that's one of our many root causes that we learn about in Balboni is sleep disordered breathing. Sometimes sleep apnea is one type of sleep disordered breathing, but there are many others, including upper airway resistance syndrome and some others. And so during all of these nighttime disordered breathing conditions, the patient's oxygen level drops a little or a lot, and their brain detects this lack of circulation and wakes them up. Sometimes they're micro arousals, sometimes they're total arousals, sometimes the patient completely stops breathing for seconds at a time. That would be detected as an apneic episode where the partner nudges you, you're not breathing, wake up. And then you wake up going with that great loud snore that peels the paint off the walls. Those are relatively easy to identify. And yet many patients refuse to come in and get treated. They refuse to get tested because they believe in their mind that the one and only treatment for their sleep disordered breathing is CPAP machine. And they have a fear of having their face covered, or they have a very sensitive skin and they're allergic and they know they can't even put face cream, let alone a device on their face, or they break out, they couldn't handle it, or they just don't want to have a machine that they're dependent upon. They live in an area that doesn't have reliable electricity. Whatever the reason, they're refusing a sleep test because they refuse the treatment off the starting block. Well, that's not fair, because as you just rattled off, there are many, many treatments for sleep disordered breathing that don't require CPAP machine. So we need to get the diagnosis, and it means working with an experienced expert to read your sleep test result, because the parameter that most people go by is called the AHI, the apnea hypopnea index, and that will diagnose your sleep apnea as mild, moderate, or severe. But there's another marker in there called the RDI that's often ignored. If there's a mismatch between the AHA and the RDI, many patients will have a subset of sleep apnea called upper airway resistance syndrome. And the people that have this in my practice the most are slender, young, female, and typically very beautiful. And nobody would ever expect that they have disordered sleep, that sleep disordered breathing. It would, and that, because you think about sleep apnea patients as Jabba the Hutt, right? Those are, in your mind, sleep apnea patients have these very large, short necks, and they're often morbidly obese, and they snore when they're sitting still, let alone when they're sleeping. Yes, those people often do have sleep apnea, not always, but often. And these young, slender women, often in their teens and 20s, still have disordered sleep, sleep disordered breathing, and an RDI elevation on their sleep test can help us diagnose this.
And the RDI, what does that stand for?
Respiratory Distress Index. And what is interesting is that if we talk about mild sleep apnea as a score of 5 to 10, people with mild sleep apnea often have mild symptoms. People with mild upper airway resistance syndrome often have severe disabling symptoms. So there's a mismatch. Even though they don't have classic sleep apnea and their AHI is normal, their sleep is profoundly disturbed. They often wake up with terrifying nightmares. They have panic attacks in the middle of the night. They go to the emergency room and the emergency room doctor says you're having a panic attack or anxiety. They get put on an antidepressant or an anti-anxiety medication. And the real problem was in the middle of the night, they were choked for oxygen and they couldn't breathe, and nobody recognized that they were strangling to death, and that's why they were anxious. So when we identify these patients, we can do great things to help improve their sleep. And you mentioned several of them. Open the nasal passage so that they learn to breathe through their nose. Many people have not done this since childhood, so we have to retrain them. That means taping their lips closed for 5 minutes and practicing breathing through their nose while they're awake. And then taping their lips closed for 10 minutes or an entire TV show or an entire movie, and practicing to the point where they can get to the place where they can tape their lips closed and breathe through their nose for 7 to 8 hours through the night. Sometimes they need a little help. Their nasal passages are terribly clogged. So we need to work with our ENT people. Sometimes there's DIY things you can do, little splints that you can put up in your nostrils to open them, or a breathe right nasal strip to pull that soft tissue open, or seeing a craniofacial massage therapist who can get the tension in your fascia of your skull. And I see this especially in people who've had a whiplash injury. They often will have all this fascia bunched up in their face, and they can't open their nasal passages when they breathe. Sometimes surgery is required, nasal surgery or a tonsillectomy. So lots of things we can do to treat sleep apnea. Sometimes it's put a tennis ball in the back of your pajamas so you can't roll over onto your back. If you only have sleep disordered breathing on your back when you sleep, let's not let you sleep on your back. Let's find a way to get you sleeping on your left side or your right side or on your belly, depending on what your particular test shows. Sometimes it's wedge pillows. Sometimes it's there's a baffle backpack that we can give you that you wear. You blow up this little tube in between your shoulder blades, and you can't roll over on your back. So there's many treatments for sleep apnea. The most extreme is something called MMA surgery, maxillomandibular advancement surgery. This is covered by almost every insurance plan. It has about a 90 to 95% cure rate for sleep disordered breathing and sleep apnea, but it's drastic. They go in your face, underneath the gums. They cut your face bone, your maxilla, in half. They cut your mandible, your jawbone, in half. They pull those fragments of bone forward, do bone grafts and screws and plates, and give you however many extra millimeters of space you need to pull your tongue forward. And this is often combined with something called oromyofunctional therapy, OMT, which is like physical therapy for your jaw, lips, and tongue, so that you learn to put the tongue in the roof of your mouth where it belongs, where you get your facial muscles and lips strengthened so that you can hold that ometer, that mouth position, in a proper position while you sleep. So CPAP's not the only treatment for sleep apnea. There are many, and working with an expert to help you figure out how to treat your individual case of this sleep disordered breathing can be life-changing.
Yeah, and I also wanted to touch on tongue tie. So I saw an ENT, numerous times during my childhood, adolescence, and even early adulthood. Never once did they mention tongue tie. Turns out I have mild to moderate tongue tie. So I'm going to get a frenectomy with, it's non-ablative. So they're using the laser, but I'm going to do the myofunctional therapy first, because my two colleagues locally, they said, if you release that and the tongue's not in the proper position, it could actually worsen the apnea.
This is true.
And so I thought it was really neat, everything you said about, the sleep disordered breathing, and especially the correlation, because everyone thinks that you have to be overweight or even obese to have sleep apnea, but it really has to do with maxillary width, mandibular advancement, how much real estate the tongue has, is it in the proper resting position? And even when I did orthopedic rehab, I would tell patients, make sure whatever exercise you're doing, your tongue's on the roof of your mouth, because it stabilizes the cervical spine. My colleague locally, she said she's treated several other doctors who had tongue tie, and because of the fascial connections from the tongue down to the bottom of the spine, they said that their spine felt healthier and more mobile and stable than at any point in their life.
Yeah, I've heard that before too. I have a friend who's a dental hygienist, and she's assisted on many tongue tie release surgeries. And so the way that happens is we have that little frenulum underneath the bottom of our tongue. It's supposed to be inserted far enough back that we should be able to get the tongue on our roof of our mouth with our mouth open, 3 fingers, to be able to still get the tongue up to the roof of your mouth. And if you cannot, often that little frenulum is attached too far anterior. The classic sign is when they lift their tongue up, it makes a heart shape, but that's a very severe case. Anyhow, she said that she would assist on these surgeries, and she'd be holding these little babies, and they'd have their tongue tie clipped, and she said instantly their rib cage would expand a whole centimeter or more. Like, she could tell when the dentist was done, she wasn't even watching what the dentist was doing in the surgery, by how that child breathed and how their countenance was. Like, they took a deep breath for the first time in their life, and their entire body relaxed. So yes, your female patients can correlate to this. If your pantyhose is all bunched up in one place, no wonder you're not going to feel right. We got to unbunch the pantyhose, and if it's bunched up underneath your tongue, nothing north or south of that is going to feel right. So
Absolutely. And in terms of breathing techniques, we know that breathing, strategic breathing and breath work can help to lower hypertension, decrease blood pressure, and help to balance the autonomic nervous system. Do you have specific techniques like the 4-4?
yeah, I
Age
actually mentioned several of them in my book. And I say that, I think it's important that we each find a breathwork technique that works best for us.
Mhm.
Classically, the Navy SEALs breath is a 4 in, hold for 4, 4 out, hold for 4. So in, hold, out, hold, box breathing. And I feel smothery when I do that breathing technique. I don't like that hold in between. It just makes me feel yicky. But I love a breathe in for 5 seconds and breathe out for 5 seconds. And that even in out works really well for me. There is some evidence that a more prolonged exhalation is a little more parasympathetic and helps lower the blood pressure a little bit better. But if it makes you feel smothery and anxious, don't do it, because that's not the right technique for you. So breathe in for 5, hold for 6, breathe out for 7 is a classic breath technique. And I just say, try them all and practice and see what works best for you, because what works best for me is probably not going to be best for you. And you just need choices.
What are some other areas that we haven't touched on that influence cardiovascular health and specifically hypertension?
Yeah, well, I would say that we touched on it briefly, but I want to drive the point home because it's what killed D. I found out later that I said, Cheryl, I went to this conference and I learned about root causes of oxidative stress and inflammation that can cause stroke and can cause heart attack. Did your mother, by any chance, have any dental problems? And she said, oh, well, 2 weeks before she died, she got a toothache. She went to the dentist and they had her take antibiotics for 2 weeks, and she was scheduled to have her tooth pulled, but she never made it to her appointment. And so we now know that these endodontic lesions, bacteria abscesses at the bottom of the tooth root, every time the patient chews, it can leak lipopolysaccharide. I will use the word, I hope we don't have to bleep this out, but my friend Lindsay Berkson coined the term little pieces of shit, because lipopolysaccharide comes from gram-negative bacteria, which are found in the stool and the mouth of the cell wall of gram-negative bacteria. And they are highly inflammatory polysaccharides, and they can trigger plaque rupture, and they can cause strokes, and they can cause heart attacks. And I am 99.9% certain that that's what the root cause for D was. She had a toothache and an infection, and it set up a lesion in her brain that ruptured and caused her stroke. And so as a primary care provider, I do screening lab work. And when I see a patient that has elevated C-reactive protein and elevated myeloperoxidase, there's the evidence in the dental literature that this is highly associated with endodontic disease. So as their primary care provider, I identify a blood test that says, oh my gosh, you probably have a dental infection somewhere in your mouth. Please go see a biological or holistic dentist, get a cone beam CAT scan, have them take an extra careful look at any teeth that don't feel right or have had work. If they've had a crown, a cavity, a root canal, those are the most suspect, but it can happen in virgin teeth too. And take a deep dive into your dental health, because these dental lesions are probably the number one hidden risk factor to the number one killer in our country.
Have you had a lot of experience with the Perio Protect trays that use hydrogen peroxide?
Yeah, so this is one way. This is more for periodontal disease or gum disease than it is for endodontic or root canal disease. But yes, this is one way that an enlightened dentist can work with you to eradicate the bacteria that are causing your gum disease without having to do gum amputation surgery. So there are some bacteria that respond really, really well to those types of, they're like Invisalign. They go a little bit higher up in your gum, and they have a special, sometimes it's an antibiotic solution, sometimes it's hydrogen peroxide targeted for your individual case. And then you wear these things a few minutes to a few hours a day to kill those bacteria that are causing the periodontal disease. However, that by itself will never be enough unless the patient's terrain is also addressed.
Yeah, absolutely. And do you have, again, I know you have to work on the terrain, but the LANAP procedure?
Yeah. So that LANAP is a laser type device that helps to eradicate these bacteria. So there's laser, different types of procedures work better for different bacteria. So we're getting a database, and through artificial intelligence, we're able to understand, oh, AA works better with LANAP than it does with PerioProtect trays, or PG works better with laser than it does with LANAP. And so we're starting to curate this data and get a better understanding of which specific bacteria respond to which specific therapy. And that'll be a game changer for people, because you don't want to waste money doing a treatment that's not likely to be effective. Furthermore, the whole mission is to get those pathogens eradicated. And so a comprehensive program of treating the pathogens, treating the terrain, enhancing the friendly probiotic bacteria, that'll get you to a state of good oral health.
What's something that you know today that you wish you would have known 10 to 12 years ago in practice?
Yeah, I think if I'd known 10 to 12 years ago that dentists were going to be my best friends, I would have fostered those relationships a lot more and invited all the dentists that I met to go to these courses so that they can be partners for us as providers, but also for our patients.
Absolutely. So where can people get your book?
It's on Amazon. It's available at the Blood Pressure Blueprint, Dr. Ellie Campbell. You can also pick it up in my office. They're $5 cheaper if you come stop by and meet us, which is in Cumming, Georgia, north of Atlanta. And it is available currently as an ebook for only 99 cents, as well as the paperback copy. So I'll probably in 2024 record the audiobook, but didn't have time to get that done this year. It just came out November 14th, so it's a brand new release.
Awesome. Well, congratulations on your book. Thanks for the work that you're doing. Thanks for advancing the field of functional and integrative medicine and overall healthcare in general. And hopefully we can have you back on next year for an update.
Thank you so much. Thank you for the platform to share this information with your providers and patients, because it is enlightened, empowered patients who bring this information to their practitioners, who can come to courses offered at the Hinman Dental Conference, American Academy for Oral and Systemic Health, AAPMD, and other similar organizations where the medical doctors and dentists meet together to learn as much as we can to help all of our patients. So thank you so much for being here and letting me have this opportunity to talk to your audience.
Thank you so much, Dr. Campbell. We'll talk again soon.
Yes, sir.
Bye-bye.